Hello, I'm Heidi, the veterinary nurse. I work at Wood Green, the animals charity. I've worked here now for 14 years. I completed my training here also. Before getting the job at Wood Green, I did school subjects surrounding around science, maths and English, concentrating on my GCSEs for that level. After school, I completed an MVQ in caring for animals and also a national diploma in animal care. I was then employed by Wood Green, where I completed a work placement to get my qualification. This involved working 4 days a week and attending college 1 day a week. Nowadays that is different. You go to college for a set amount of time and then go to a work placement for a set amount of time. At my job here, I do various things, looking after various animals, from guinea pigs, rabbits, dogs, cats, various things like that. I look after them, I make sure they're okay. I take care of their medicines, I make sure they get correct diets. I look after wounds, I clean ears, I get all the mucky jobs, looking after them. But also, there is a good part of my job which has sometimes come home with you, and that is hand rearing of kittens. I get to play mummy to little baby kittens. And here I've got my two current children. This is Tilly. She's a 7-week-old kitten. She's here at the centre with her brother, Billy, also 7 weeks old. You can see they're very lively. They want to run around. I have to feed them through the clock with milk, and then I have to get them onto meat before they can go into the homing runs of our centre before they find their forever home. So they're with me for a good sort of like 6 to 7 week period before they move onwards. It's very lovely. You get to play with kittens and squish them a lot of the time. So I do that, as well as looking after the kittens and things like that. Especially more important with kittens as well is I take care of flea treatments, worming treatments. I work alongside the vets, making sure that all the animals get their correct treatments. Kittens have a more increased worming regime than adults, but the general rule for when they get to adults is you've got flea treatments, which you can get at your various pet stores, pharmacies, and veterinary surgeries. The flea treatments are generally every month for cats, every 2 months for dogs, but obviously there's various different treatments. You need to look at the individual packets to make sure that you are treating them correctly. With worming, it's generally every 3 months for both dogs and cats. It's important for flea treatments and worming treatments to give them to your animals to make sure that they're up to date. One, it's not very pleasant for your animals. Fleas can cause a lot of skin irritation, which can lead to a lot of skin disease, which can be quite costly, expensive, and not very pleasant for your animal to go through. And worming, obviously, if they have parasites within their bodies, their health is not going to be at best. But also there's a risk of transferring it onto children as well. There's various things that can happen, so it's always good to keep your animals up to date with their flea treatments and worming treatments. Now here we have Humphrey, my little friend here. I'm just going to show you how to place the flea treatments. Like I say, these are readily available nowadays. You can get them in various packets. You've got cat specific ones, dog specific ones. Comes in a little plastic pipette. It's filled with the fluid in there. You snap off the top, and then on the scruff of their neck, so all the loose skin right at the back of the neck, what you need to do is you need to part the fur so that you can get down to the skin. Place the pipette, turn it upside down, squeeze it out, making sure that it goes on the skin, not just on the fur, otherwise it's not going to do what it needs to do. And then obviously once that's been applied, you need to avoid stroking your cat for a little while, and they're not allowed to have a bath for a good 24-48 hours afterwards, otherwise you'll wash it away and it won't work. Now wormers, you can get different preparations. The most common part is a tablet. Now, depending on how clever your cat or dog is, you can give it in a little bit of food. Just give it straight down a bit of tasty food and they'll eat it no problem. Occasionally they won't eat it and you'll have to put it straight down their throat, but hopefully put it in something really nice and tasty, it won't be a problem. But that's tablets that go down in the mouth. So I do a lot of flea treatment, a lot of worming treatment. Like I say, I look after a lot of the animals, take them home with me, look after them, make sure they grow up to be big, strong, strapping animals. But there's lots of animals that come through the shelter. I couldn't possibly pick what the best part of my job is. There's so many parts. I love my job, every part of it. I've always wanted to be a veterinary nurse. I wouldn't want to do anything different, and I love every single part of my job. When it comes to a favourite type of animal, I would probably have to, I love everyone, but if I went with a guess, I would have to go with kittens, because they are quite cute. Like I say, you can see them grow and turn from these little blobby kittens that don't do an awful lot to kittens and cats that have their own personalities. So it's very rewarding to watch them to go from stage to stage as they grow. That's pretty much it, really. I love my job, I love Wood Green and the animals here at the centre, and I wouldn't want to do anything else, and I would like to see more people following that as a career choice.